Bismillahirrahmanirrahim and Assalamu alaikum. I am Dr. Saima Rashid and today I am giving the presentation on lactation and effects of different hormones on breastfeeding. Learning objectives: students should be able to understand the physiology of lactation and they should be able to describe different processes of lactation including mammogenesis, lactogenesis, galactokinesis and galactophoresis. Lactation, it is defined as the secretion of milk from the mammary glands. It usually refers to the post-delivery period that a woman lactates and nurses her baby to provide nutrition and immune protection. The fundamental breast tissue, the fundamental secretory unit of the breast is a alveoli, and which is surrounded by myoepithelial and adipose tissue. These alveoli are organized into lobules which drain into ductules. About 15 to 20 ductules drain into a single duct that opens outside, and it also widens to form a small reservoir for the milk. Now, physiology of lactation. It is divided into 4 phases: preparation of breast, that is mammogenesis, synthesis and secretion of breast alveoli, lactogenesis, galactorrhea, milk production, which is followed by the ejection of milk, galactokinesis, which is also termed as the milk letdown reflex. And then this kind galactokinesis is followed by the maintenance of milk production. It requires the prolactin hormone. Now, the first phase of lactation, that is mammogenesis, and this is the phase for the preparation of breast. There is hypertrophy and hyperplasia of the breast tissues along with the growth of the lobules and ducts of the breast. And this phase is under the influence of 2 major hormones, that is estrogen and progesterone. Estrogen results in the proliferation of the mammary duct and progesterone is the growth of the lobules and the ducts. Other hormones are also there, but they are not playing their significant role, but they are influencing some of their parts. Other hormones are the prolactin, cortisol, thyroxine and insulin growth factor. Other hormones are the prolactin, cortisol and insulin growth factor, including human chorionic somatomammatropins and the human placental lactogens. But this phase is extremely under the influence of the high level of estrogen and progesterone. At the end of the 3rd trimester, this phase is being observed. That is, this is a welcoming sign by the mother for her child. In the last trimester, in the near the term pregnancy, there is a preparation of the breast or growth of the breast. But at the time of delivery, that is the parturition, there is withdrawal of estrogen and progesterone. That is, there is decrease in the estrogen and progesterone, which is being overlapped by the high level of the other hormone, that is the prolactin. And this prolactin is markedly increased during the process of lactogenesis, that is the synthesis of milk, and this phase is following the mammogenesis. That is, after mammogenesis the phase of lactogenesis occurs, and this prolactin, it is a polypeptide hormone, and the synthesis and release of the prolactin is being synthesized and released from the anterior pituitary, and they act on the lactotrophs, which increases the milk synthesis. It encodes several milk proteins and stimulates the transcription of genes that encode several milk protein, including lactalbumin and casein. Now, this lactogenesis is being under the influence of a high level of prolactin and this is being observed in 2 stages. In the first stage, there from the time of birth up to 4 to 5 days after delivery, this stage is the secretion of a thick yellow stained mucus or fluid, and that is termed as the colostrum, and that is highly nutritious and it should and must be given to the newborn baby. Now, this colostrum is being replaced by the menstrual milk after 4 to 5 days of delivery. Its quantity is 10 to 40 milliliter, and it is highly rich in protein, vitamin, and the other essential nutrients. Now, this lactogenesis, in this stage of lactogenesis, there is increased synthesis of milk, and a healthy mother will be producing about 500 to 800 milliliter of milk per day, with an average of about 500 kilocalories of energy per day. Now, this lactogenesis, in this phase, there is increased milk synthesis under the influence of the prolactin hormone, and these milk protein, including lactate, albumin, and casein, they are being synthesized in the endoplasmic reticulum of the alveolar breast tissues. That means in the epithelial cells of the alveolar breast tissues, these milk proteins are being synthesized, and from the endoplasmic reticulum, it is being transferred to the Golgi apparatus. And in the Golgi apparatus, there is a presence of an enzyme, lactase synthetase, which activates the synthesis of milk or lactose. And lactose is a major carbohydrate. Now, this, along with this lactose, there is the transportation of water molecules under the influence of the osmotic gradient. That is, from the maternal blood, the water molecules comes into the interstitial fluid, and from the interstitial fluid it comes into the epithelial cells of the alveolar epithelial cells by the osmotic gradient, and from the alveolar epithelial cells, these water molecules are being transmitted from the epithelial cells into the lumen of the alveoli. Now, along with the lactose and water transportation, there is transcellular receptor mediate transport of the immunoglobulins, and these immunoglobulins are being transported from the blood into the interstitial fluid, and from the interstitial fluid into the alveolar epithelial cells, and from the epithelial cells they are being transported into the alveolar lumen by the process of exocytosis, and in this way, from the alveolar lumen, it is being transported into the breast milk, and the antibodies, specifically there is transportation of IgA antibodies, and 600 different species of various bacteria. The antibodies give protection against the 600 different species of various bacteria, specifically the endocannabinoids, and these are present, they are found in the breast milk, and they stimulate the appetite, and they are the stimulant of appetite, and they also regulate the appetite of the newborn. There is transportation of antibodies, and about 600 different species of various bacteria, the immune is being protected. Now, the other one is the endocannabinoids. This substance or this fluid is also present in the breast milk, and it provides the appetite, acts as an appetite stimulant. It also regulates the appetite of the newly born baby. Now, we are moving towards the other process, that is the galactokinesis, and galactokinesis is the transmission of galactokinesis is the milk letdown effect or ejection of milk, and it is being under the influence of oxytocin. When the baby sucks the mother's breast, the suckling, it initiates a suckling reflex, and sensory nerves send the impulses are being carried by the thoracic nerve T4, T5, and T6 to the higher center, and that is the hypothalamus, and in the anterior pituitary, this prolactin is being synthesized and released, and this prolactin will be causing increase. This oxytocin, through the thoracic nerves T4, T5 and T6. These sensory impulses will be taken to the anterior pituitary, where oxytocin is being synthesized and released from the posterior pituitary. And once the oxytocin is being released from the posterior pituitary, it acts on the myoepithelial and smooth muscles of the tissues and on the smooth muscles of the uterus, and this oxytocin will be causing contraction of the myoepithelial and smooth muscles of the breast tissue, and at the same time this oxytocin will be having receptors on the smooth muscles of the uterus and will causing the contraction of the uterine smooth muscles, helping or facilitating the involution of the uterus, thereby reducing the blood loss from the uterus. That means the more the baby is being breastfed, the more of the oxytocin will be released, acting on the myoepithelial of the breast, causing contraction of the breast, soft tissues, smooth muscles, and the contraction of the uterine smooth muscles. At the same time, helping the milk let down reflex or facilitating the breast milk babies to be breastfed, and causing and facilitating the involution of the uterus in order to reduce the sign to the normal. That is the pre-pregnancy stage. During a suckling and a conditioned reflex is set up, ascending impulses from the nipple and the areola are being sent from the T4, T5 and T6 to the paraventricular supraoptic nuclei of the thalamus, and oxytocin from the posterior pituitary produces contraction of the myoepithelial cells of the alveoli and the ducts containing the milk, and it will be termed as the milk letdown or milk ejection reflex. Now this is termed as the milk letdown reflex. Now this galactokinesis is being followed by the process of galactopoiesis, which is maintenance of the breast milk, and it is under the influence of high levels of prolactin. The more the baby will be breastfed, the more prolactin will be released, and this prolactin will be sufficient to synthesize milk, and as we have observed in the lactogenesis phases and in the maintenance of milk production, that will be observed for in order to provide the baby nutrition for about more than 1.5 years. Now, hormonal control of lactation. There are estrogen, progesterone that stimulate the breast development during pregnancy, and both these hormones are high during the last trimester of pregnancy. Now, these hormones are being followed by the high level of prolactin, that is the anterior pituitary, and stimulates the milk production. And this prolactin is being synthesized and released from the anterior pituitary, and oxytocin, that is oxytocin that is being released from the posterior pituitary, and it will be having facility causing the contraction of the smooth muscles of the breast, causing milk letdown reflex, and facilitates the uterus to return back to its normal stage in order to facilitate the involution of the uterus. Now, the composition of the breast milk. As we have already discussed, there is a large amount of antibodies, specifically the IgA, that is being transmitted from the maternal blood into the interstitial fluid, then into the epithelial cells of the alveoli, and from the alveoli into the alveolar lumen. And there are also presence of certain components, that is the protein, that is about 43.9%, lipids, that is about 8.4%, and carbohydrate, that are about 44.5%. And carbohydrates is being provided in form of lactose. Now, the transmission of proteins. Human milk has 1.1 gram of protein, and it has got 20% of beta casein that is absorbable and digestible by the delicate intestinal epithelium of the neonate, whereas the cow milk has 80% of the alpha casein, and this cow milk is not being absorbable and digestible by the newborn baby. Now, these proteins like the albumin provides the essential amino acids in the brain development. Cysteine and methionine, central nervous system, helps in the it has these proteins are include the cysteine and methionine, which helps in the central nervous system development. It also includes the transmission of taurine, that is also important for the brain and retinal development. Moving towards the transmission of lipids, and these lipids, unsaturated fats, these are the unsaturated fats, and steroids, phospholipid, cholesterol, and they help in the development of the brain, that is the polyunsaturated fatty acids along with the omega-3 fatty acids for the development of neuronal cells. Now there is the transmission of minerals, and these minerals are bound to protein and enhances the bioavailability. Human milk enhances the zinc ion absorption, and it contains less poisonous residues, namely chromium, aluminium, and manganese. Along with the minerals, there is also transmission of vitamins, and it will be depending on the mother diet. These diet are rich in vitamin A, C, E, and D, and thiamine, and about 25 to 30 milligram of folate is also being transmitted by the maternal blood into the by the maternal breast milk into the fetus. It also prevents xerophthalmia and ketomalacia. Now, the more the baby is being breastfed, the more there will be the amount of increased milk production by the high level of prolactin. Now, this lactation, it also provides a natural way of contraception in a way that when there is increased breastfeeding, that suckling reflex will cause high level of prolactin, and when there is high level of prolactin, that will cause decrease level, or that will cause reduced amount of gonadotrophin releasing hormone release, and as they are inversely as they release, when gonadotrophin releasing hormone are being decreased by the that is when FSH and LH are decreased, there will be failure of the ovarian cycle, and the baby will be unable and the patient will be unable to observe her ovarian cycles, and in a way she will be having the lactational amenorrhea, which is also beneficial for the patient to improve her nutritional status, and there will be no blood loss in terms of menstrual cycle, and she will be observing her amenorrhea stage. Now, when in such patients, when there will be not not a sufficient amount of breast milk production, then we will be giving her the medical supplements, and that will be the dopamine antagonist, as dopamine is an antagonist of prolactin. So if we are going to inhibit the dopamine, there will be the intense increase in the prolactin, and dopamine antagonists are the domperidone and metoclopramide. So, in a nutshell, the revision, the lactation consists of 4 stages. First, there is mammogenesis, that is development of the breast or growth of the breast tissue, ducts, and lobules. Then this mammogenesis is being followed by lactogenesis, that is the synthesis of milk. Now, this lactogenesis is being followed by galactokinases, which is the milk letdown reflex or milk ejection reflex. Now, this galactokinases is being followed by galactopoiesis, that is the maintenance of milk production. So, different phases in mammogenesis. When there is development of the breast tissue, it will be under the influence of high level of estrogen and progesterone, but with the delivery of the baby, there will be the withdrawal of estrogen, and then this phase will be followed by lactogenesis, which is under the influence of high level of prolactin, which will facilitate in the the synthesis of milk. Then this lactogenesis is followed by galactokinesis, which is the phase due to the high level of oxytocin, and this oxytocin will help in the contraction of the myoepithelial smooth muscles of the breast tissue, causing milk ejection, and at the same time it will be causing contraction of the smooth muscles of the uterus, causing involution of the uterus. And this galactokinesis is being followed by the galactopoiesis, which is the maintenance of milk, and it will be due to the high level of prolactin. Thank you. That was all about the lactation and effects of different hormones on lactation.